guys, me again, Gareth Williams, Specialist Orthodontist. I'm going to talk to you today about retainers. So retainers are the way that you keep your teeth straight for the rest of your life. Now, a lot of people misunderstand retainers because the advice has changed over the years. The advice that we give these days is that everyone should wear retainers for the rest of their lives. And the reason for that is, as you grow older, your teeth crinkle and wrinkle in response to the way that your face wrinkles. It's very depressing but true for all of us. And as that happens, your teeth become more crooked. A lot of people think, oh, they go back to where they were. They don't actually. They tend to take on a wholly new configuration of crookedness that responds to the way that skin ages, that in turn compresses on your teeth and squashes them inwards. That's all that happens, really, to everyone, all of the time. So if you don't wear retainers for the rest of your life, your teeth will definitely be more crooked than they are now. Whether they get crooked enough for you to notice that difference is a risk for you to bear. But if you don't want to take that risk, wear the retainers for the rest of your life. What we advise is that you wear them every night to start off with, and then over time gradually decrease that wear down to an absolute minimum of 2 nights per week, which can either be next to each other or spaced apart. To work down to that, what you can do after about 6 months is start missing a night here and there. If when the retainer is placed back in, it's still comfortable and doesn't feel excessively tight, that's a sign that you can adopt that period of decreased wear and keep reducing it very gradually, very carefully until you're down at that 2 nights per week. You might never get there. You might find that 3 nights a week is the minimum that you can do without it feeling excessively tight. Just to remind you, a tight retainer is the sign that the teeth have moved, so you need to wear it more. A comfortable retainer is a sign that the teeth are staying where they are. To clean them, use Retainer Bright. The instructions are on the packet. Don't brush them with a toothbrush. Don't brush them with toothpaste. It'll scuff them and cause them to be less effective and more likely to crack. Don't put them in boiling water. It's a very common thing to do. It melts them. They're made from plastic, essentially. Don't feed them to your dog, and keep them out of areas where your dog could get to them. So in a retainer box, higher than the height of the dog when it's standing on its back legs. The amount of patients that we get that have lost retainers to dogs and boiling water is very, very high. Under the NHS, you are provided with a single set of clear plastic retainers. Privately, you are additionally offered fixed retainers, which are metal wires that run along the insides of the teeth, which give you that additional layer of protection and a need perhaps to be able to wear your clear retainers slightly less than the minimum of 2 nights per week. I hope that gives you all the information you need, and best of luck, guys.